Good morning, everybody, and welcome to another edition of On the Clock with Personal Living Alert. I'm David with Personal Living Alert, and today we're going to talk to my friend Dominic Aloma. Dominic is with United Care Home Health Services, and they are based here in Broward County, and we're going to get to know Dominic, what they do, how they do it, and what's going on in their lives. Morning, Dominic. How are you today?
Hey, good morning, David. How are you? Thanks for having me. I appreciate it.
Not a problem, my man. So, Dominic, I kind of start these things off with what's your background? Why did you get into the senior market?
Yeah, so really, I'm kind of an old soul, and to be more personal about it, my grandfather is probably one of the most influential people in my life. And to make it pretty simple and a little bit cheesy, I kind of just think of how would people treat my grandfather? How would I want them to treat him? And that's kind of how I got into it. I wanted to make sure that seniors, especially in Florida, because it's such a heavy population, were protected and taken care of and given the appropriate skill and care that they needed.
All right. Now, United is a Medicare home health agency. What is that? And what does Medicare and what do you guys do?
Right. So we're a Medicare certified skilled home care agency. What that means is we're state certified, we're state licensed, we're ACHC accredited, which is a accreditation board agency for healthcare agency for healthcare accreditation. And what that means basically is we do skilled care in the home. We come to patients' homes and we do physical therapy, occupational and speech therapy, social worker services, home health aid services, and we basically come and help them. We're kind of like the hospital in the home. You know, when they come from the hospital, we come into the home to make sure that they can get those things. We're the eyes and the ears for the doctor to do those treatments for them.
So to me, as a general consumer, it sounds like you do more than a typical home health agency.
Yeah, so skilled care is a little bit different. I mean, a lot of times people associate home care with like an aide coming into your home and helping you with cooking and cleaning. And that is a type of home care, but skilled home care is specifically defined for that reason, where a licensed professional comes in and works with you on a skill that you couldn't do or your family couldn't do without the education, training, and intervention of those skills.
Yeah. So I'm guessing that you're probably running into a decent amount of COVID-19 patients. How is that impacting what you guys do? And tell us a little bit about that.
Yeah, you know, honestly, we actually have not yet run into a bunch of patients that have been positive for COVID-19. We have had a couple negatives that we've seen, but we haven't actively taken on a positive case that we've seen yet. You know, a lot of them have been in the hospitals. We've been anticipating because of the potential for the systems being overwhelmed, and obviously we would be one of the functions or one of the people that would come in. One of our skilled services is nursing. So we do all aspects of nursing in the home as well, skilled nursing. So that could be a factor in the future, depending on, you know, where the statistics go. So obviously, as a company as a whole, we're watching that very closely because the cases that might not be as significant, obviously the cases that don't go on ventilators, they may have to come home and they may need our services. So that is definitely a factor.
And that's going across the United States. Any type of a skilled home health agency would be able to do what you're talking about.
Correct. Yep. And they will need to be honest. Yeah.
All right. Are you having any issues getting PPE and supplies and things like that? What challenges are you and do you think your industry is experiencing today with COVID-19?
Yeah, so the PPE has been challenging. I mean, initially we were not having any luck getting any orders at all where we would easily get these things in the past. And that's including gloves, masks, full PPE, even hand sanitizer. So it became a real challenge just to try to get it. What we've done is we've talked to different companies. We've tried to work with different companies that we've partnered with in the past. And slowly but surely, we've trickled in some different equipment. Luckily, we had a stockpile of equipment from before. But obviously, in preparation of what could come, we're going to need much more. So we're working on orders. And even though they've been delayed, we have seen some issues with some potential price gouging. Luckily, some of that was resolved without our intervention because the government stepped in and said, you know, that can't be done.
There you go.
Luckily, some of the people are just doing the right thing and offering better deals because they know it's going to be a longer time to wait on some of these items. So it's been a challenge, but we're working through it and trying to make sure that we balance it out to protect our staff and our patients, of course.
Yeah, I've done a lot of these, and a couple of the home health agencies, the general type, not the skilled, uh, they've been actually pretty lucky that neighbors like firehouses and other organizations are also providing them with extra PPE equipment. I don't know if you've been lucky enough to get any of that or have tapped into those types of resources, but they're out
Uh,
there, I guess.
Yeah, no, what we've done though, that has been amazing. And we've watched some of the different people get involved in our community and even across the nation. It's been really awesome to see a lot of the unity and the kindness and the innovation of America itself is really just amazing when you see people just have to come up with something, like it's just great to watch. For us, we've tried to help and give back to some of those places as well. Like, for example, we have an excess of gowns that we don't typically use unless we have patients that require that type of PPE. So we've been working with social workers and working with some of the hospitals to see if we can give some of that back to help them more, because they're going to need more of that in some of the more challenging cases.
Well, that's fantastic. It
Yeah.
really is. It's very nice of you guys. Uh, is there a national? I know for a traditional, and I'm probably wrong for calling it a traditional home health agency as opposed to versus a skilled, but is there a national association or organization that you guys are a part of that may be offering guidance, or are you just doing it on your own? Are you in coordination with, say, the CDC or something like that? Where are you getting your information from on how to proceed
Right.
today, tomorrow?
So we're looking at definitely all the regulatory boards that are associated with Florida. We're looking at ACA. We've been talking in communication with our accreditation board, which is the Accreditation Commission for Healthcare. I want to correct that from earlier when I had my little stumble. We're also been talking with, looking at the emails and the references from the CDC, from FEMA, the Department of Health and Human Services. We've been getting emails from doctors and referral sources that work with us, whether they get emails or contacts from their hospitals. We're just not letting any stone go unturned. Basically, we want to make sure we have all the information we can. And it's been monotonous, and it's been grueling, because there's just hundreds of emails a day of things changing and things evolving, and even just briefings on the news as well. But all those things matter. So the more information we have, the more access we have, is the better we can treat our patients, and hopefully the better the community can understand how to protect themselves and everybody around.
Yeah, I think you're doing the right thing. We both live in Broward County, Florida, and it's a hot spot. Other parts of the United States, even other parts of Florida, I mean, on the west coast of Florida, there's hardly anybody. Um, what do you think about the easing of restrictions, and should we be treated a little bit differently, or do you think that certain of us should be able to go back in and help people? What are your thoughts?
So as a healthcare professional, my first thought is to not only protect patients, but protect the lives of the people that are working to save those patients. And for me, it's a tough thing, because an enemy like this that goes unseen, that can be asymptomatic for 14 days, and can be so aggressive and so unknown because it's novel. They call it the novel coronavirus because it's new. Our body has not built up any immunity to it. We don't really 100% understand it. It's aggressive with some people. It's mild cold symptoms with others. So it's difficult, and then when you couple the challenges of unemployment and the way the economy is going now compared to where it was, it is very scary, because I can understand the point on both ends, but for me, strictly speaking, as a healthcare professional, I think if we reopen, we do need to do it in stages like the government had discussed. And I think those stages need to be very carefully monitored, and really have to be open enough to be evolved or set back or moved forward, depending on how those sections are doing. And you're right, there might be a pocket of a town in North Dakota where there's not one case. They're probably going to be fine if they continue to do those restrictions, those social distancing, washing their hands, being careful not to touch their face, being aware of those things, noting people that are sick and trying to isolate their older and more the more immune compromised people that they have. But in places like Broward, where the numbers are still ticking or showing that they're going up, we got to follow the data, and if that data says that we need to hold off, then we need to hold off, because
I
it's
don't
just
know.
too scary for what people that don't know on the front line, that they don't see it. It's very, very scary what's happening.
I don't know about you, but the more I'm told I can't touch my face, the more I want to touch my
Of
face.
course, of course. Yeah. You can't eat chocolate cake, so you want a whole chocolate cake.
Exactly.
That's
Exactly.
life. And it's more scary because it's more magnified with the fact that people are out of work. are losing money, don't have a job, don't know what to do. And, you know, it's really sad because this is May is Mental Health Awareness Month. So it's even more important to kind of recognize that there is a balance. You know, it's a lot of people, and I'm sure you know, will try to make it political, but it's not so much political. It's about the USA. It's about America. I talk to people about this, and I always tell them there's two times where people come together and they don't have party involvement, and one is funerals, and the other is the Olympics. Right?
Yeah.
We want most of the time you want USA to win on everything in the Olympics. And when there's a funeral, you don't care about what party they were. You feel bad. You apologize to the family. You send your condolences. You send your prayers. Those are the two times. This is one of those times. We need to come together and focus on keeping us safe, keeping us protected in all ways. And that's not just the virus. It's working out how to balance out these other factors that are being caused by the virus.
Yeah. Now, I'm sure that you make sure your staff, when they go out, is totally protected, masked up, gloved up, all that kind of stuff. Is that going to be the new normal? Do you foresee you having to do that for the next 6 months, year, for forever? What do you think the new normal is going to be in, the skilled arena?
Yeah, I think the new normal will be dictated by basically how our society complies with regulations. So what I mean by that is if there is 3 or 4 phases to protect us or to get us back to a sense of normalcy, I think that the more that we adhere to those is the better off we're going to be and the more normalized we're going to be. With that said, I don't think there's ever going to be a normal like we knew it before. I think healthcare has learned a lesson from this. I think government has learned a lesson from this. I think everyone has had to learn a lesson about how carefully we wash our hands, what we do when we're touching our face, like you said. If we do have a fever, a cold, we're going to be more aware of that. And even with the vaccine, you have to remember, and again, not to compare this to other viruses because it's just not the same. It's not as comparable. But once you have a vaccine, it still doesn't mean that there's people that take the flu shot and don't get a flu. You still have to be careful. You still have to monitor it. And I think it's there's projections that say 2.5 years more of this. And there's projections that say in 6 months, we could get back to sports. So it's hard to weigh and balance that. The real key is how much our society complies with the new regulations and the new norms. And like you said, that's hard sometimes because people only want to do things. They don't want to do things, or they want to do them more when people tell them not to.
Exactly. And that's with going out. I mean, speaking about going out, when do you think you're going to go out again, to a restaurant? So I know they're not open here in Broward, but when they're going to open up soon, I mean, are you going to be comfortable going to a restaurant, going to a movie theater, and doing certain things that you took for granted 5 months ago?
Yeah. And that's a great question. And I think it's really a tough answer because for me personally, I'm already going out still. I still see patients 2 to 3 times a week. Our census is down, but we're still seeing patients because we're essentials. We can't let some of these patients go. We just wouldn't do that to them, and putting them at a higher risk if they have to go back to the hospital or something else is a problem. But trying to just personally, trying to get myself back into normal life, I really would have to see that the data matches and that our curve is flattening to the point that we're under more of a control than anything else. And of course, if there's not necessarily a vaccine because it's going to take much longer, but if there is appropriate treatments or safe treatments that show that they work over time where this is not as scary as it is now, then that would make a big difference for me too. But, with the exception that I love going out. I love being out with my boys, watching them play sports. I love going to the restaurants and to the movies, but it's just luxuries that we have to kind of hold off on or find other ways to support those teams and those groups without really exposing ourselves or exposing others.
I know Fabiana and I talk about it all the time. It's going to be a while for us to go back out and start our lives again. I mean, I don't know if I'm going to be comfortable sitting in a movie theater next to somebody and then they cough. I mean, you just don't know what's going to happen, or how close at a bar, at a music event and anything is. It's just, I just don't know what's going to happen and when it's going to happen.
Right. Right. And until any of us do, because really it doesn't matter. No one really knows again until they get more and more data and more information. But the best thing to do, one thing we do know that's working is social distancing, is following the hygiene practices and making sure you're aware of symptoms when they do come up. And those things are working. So we know the things that are working, let's keep doing those. The things that we don't know about yet, let's continue to learn, educate ourselves, and hopefully grow from them, But I agree with you. It's scary.
Yeah. Yeah, and I agree with everything you said. Dominic, I just want to say thank you for being on. And I know that you have all this great information because you are on the front lines, which is an interesting person to talk to. I haven't really spoken to anybody who's truly on the front line, and you're out there seeing people. If anybody has a question, anything, doesn't matter what it is, how it relates to you or whatever, how can somebody get in touch with you to ask a question or inquire about services or anything?
Sure. Well, at United Care Home Health Services, again, we're a skilled service operation. We do have someone that's on call, 24/7. So there's never a time that you can't call and reach out to us that we won't get back to you, and make sure we can try to answer your questions and help you as much as possible. Best way to reach us would be 954-475-4654. And then, of course, on our website, too, you can reach us at www.unitedcarehhs.com. That just stands for Home Health Services, hhs.com. And really, we'll be happy to try to help in any way we can, to do the best to answer the questions we can based on the information we get daily. So
Perfect. Again, I think you guys do a great service, and I just want to say thank you again for spending some time with us this morning.
Well, David, I just want to thank you for having me, and I love what you're doing. I appreciate this. To get word out and get information out, and to kind of be able to talk and chat again too is great. And as a doctor of physical therapy, which is what I do, that's my skill. I really just want to thank especially all the frontline workers and all the healthcare workers, and to be honest, all the workers that are out there putting their life on the lines and risking their life to make our lives a little bit more comfortable during this time. It's really amazing. So I really appreciate them, and I appreciate what you're doing as well. Thanks so much.
Thank you, and hopefully I'll see you in about a month or so when we all get back out inside and do things together.
I hope so too, man. That'd be great.
All right, take it easy, my friend.
You too, Dave.